Assalamualaikum. Today our topic is medical legal certificate. Medical legal certificate and postmortem, these are two topics which every medical officer working in peripheral government hospitals should have to tell. Actually, medical legal certificate is a vast topic and there are differences which vary from case to case, but there are some points which are basic to every case. For this medical legal work, you have police involved in this, and a constable or victim's relatives or sometimes victim himself brought a police docket to you for issues of this medical legal certificate. And on that police docket you will find some things which are written like victim's name, father name, police constable name, and number of police constable, nearby police station. First thing you have to fill on medical legal certificate is name of the victim. And remember, name of the victim should be written on medical legal certificate according to ID card of victim. But if the victim is under 18, not having ID card, so name of the victim in case of minor will be written on medical legal certificate according to name given by the minor's guardian, either father or uncle or any. And if they produce bay form before you, then name of the minor should be written according to bay form. But if you find that name which is written on the ID card of the victim, or in case of minor telling by the guardian of the name is different, which is being written on the police docket, then you should inform the police constable that they have to change the name on police docket according to ID card of the victim. Next column you have to fill is cost. Most of the time cost is being written on the police docket. Next column you have to fill is address. Again, address of the victim should be written on the police docket, and you write here according to which is being written on the police docket. Next column you have to fill is ID card number. This ID card number should be of the victim, but in case of minor you left this blank. Next column you have to fill is ID marks, identification marks. At least 2 identification marks you have to return. These identification marks you can find on the ID card of the victim, but if you cannot find any of on ID card, you have to mark these by himself and find them. Maybe a mole, a scar mark. Remember, exact anatomic location of mole or scar mark should be written. Next column you have to fill brought by. Either by police, relative, or himself. Next, you you have to fill column constable name. And number. And again, you will find constable name and number on police docket. Next column you have to fill is admission. Most of the cases, you this column should be nil, no admission. Next, you have to write history of. There are different scenarios according to which you write here. Maybe there is a history of fight. Maybe history of firearm wound, firearm injury. Maybe is a dental injury. Maybe is poisoning. In rare cases, you can have human bite, burn, human bite, burn, and sting, drowning. These are some scenarios you can have in case maybe you can have a history of fight in which you can have victim and you have to examine these victims for injuries. Maybe you can have a firearm injury in which you have to find the in and outs of the bullet, pellet. You can have dental injuries, poisoning, human bite, burn, sting, drowning. We will discuss these all one by one. Next column you have to fill is close. You have to write color, any stain, any torn, remember in case of clothing, if victim had changed clothes, then you write clearly that victim has changed clothes. Next column you write about the conscious level of the victim, vitals including blood pressure, pulse, and orientation. Remember, this column is very easy to fill if the victim is talking freely, telling his name, telling his address, and about the history of the fight or any other you have to go through. But in case of head injuries, you have to be very careful about these terms. In head injuries, you have to look after GCS. And according to GCS, you write these things. Either he is conscious, vitally stable and oriented, or not oriented, conscious, semi-conscious, unconscious, not oriented. But this thing is only related to head injuries, in which GCS is decreased. But in head injuries, if you find GCS is not decreased or normal, then you will go with the normal pattern. Next, we are going to discuss these things one by one. So, first we are discussing fight. If you find a victim or victim present to you with the history of fight, then most of the times you will find some lacerations or incised wounds, stab wounds. Importantly, we will discuss only one or two things about fight. For example, you will find an injury on the victim. You have to write three things very clearly. What is the length of the wound? What is the width of the wound? And what is the depth of the wound? These three things you have to write very clearly. What is the length of the wound, and you can use measuring tape. Use measuring tape for length, width and depth. Next, you remember other thing which is very important for location, exact location of the injury. First, length, width and depth, centimeters. Then exact location of the exact location. You can have a reference point for any injury. You can have a reference point to locate the exact location of the injury. These things are very important in any injury to write. Next, third thing which is very important to write is either it is incised wound or lacerated wound. In every injury or wound which you find on a victim which is involved in physical assault or fight, you have to write these things about this injury. Length of the injury wound, width of the wound, depth of the wound, exact location, and either wound is incised wound or lacerated wound. Some wounds are maybe not very deep and you don't have to advise any investigation, but in some cases there are some wounds. For example, if there is a wound is present in on a scalp of the head, then you have to write X-ray of the skull, and you have to follow for radiological expert opinion for any scalp injury, bone injury. This thing, depth of the wound is important in case either is a skin deep or muscle deep or bone deep. These three terms, skin deep, muscle deep and bone deep, commonly used for this depth of the wound, but in some scenarios you can use only either bone exposed or bone not exposed. In some cases, maybe injury is present on a part of the body where there is no muscle present between skin and bone. So in these scenarios, these terms becomes complicated. So in these cases, you can only use either is a bone exposed or not bone exposed. What is bone exposed mean? That shows you see a visible bone under wound. Bone not exposed, no visible bone. You see. Next. What important thing which another you have to know about these terms, that you can write a whole of this. For example, a lacerated wound length 4 cm, width 3 cm. Next point, what is? We have decided what is lacerated wound or incised wound. It is a lacerated wound. Next, what is length and width? 4 cm into 3 cm. You can use measuring tape for this. What is the depth of the wound, of lacerated wound? Either it is bone exposed, bone not exposed, or skin deep, muscle deep, or bone deep. Suppose we have seen that bone is exposed, that bone is visible. So we write bone exposed. So length, width, depth, lacerated wound or incised wound. Next important thing, what is exact location of this wound? For example, suppose it is located cm above left ear pinna. So it is located 10 cm exact above left ear pinna. So our statement is complete. Next thing which is remaining is either we have to advise an X-ray of skull or not. In bone exposed cases and lacerated cases, most of the time the weapon is blunt. Maybe either a some kind of rod or anything solid which can tear we can tear the bone, so we have to advise X-ray. In this case, skull. And remember, always advise two views of this X-ray, anterior-posterior and lateral. So this is all about injuries which you can find about in case of history of fight, a lacerated wound. You can also have a incised wound. Again, if you find an incised wound, then write again length of the incised wound, depth and width and depth, and again location of the incised wound, and either you have to write any investigation. In most of the cases in incised wounds, if there is a deeper bone is present, then in most of the cases incised wounds there is no need to advise X-rays. But if these incised wounds are present on abdomen or chest wall, you have to write in case of abdomen you have to write ultrasound of the abdomen, and in case of chest again you have to write X-ray, because the incised wounds go deeper than the lacerated wounds, and in body cavities they can penetrate and damage the vital organs. This is all about history of fight. Next, firearm injuries. Most of the cases firearm injuries are same as history of fight, and in firearm injuries you can also have injuries like lacerated wound and incised wound like in physical assault. But in firearm injuries, the difference between history of fight and firearm injuries, in firearm injuries you have to find out the entry wounds and exit wounds. In firearm wounds or firearm injuries, entry wounds and exit wounds are both important because these are very important for medical legal work and for police and investigation. That what is the direction of the bullet and what is the direction of the bullet, and what is the position of the victim when this happens. Again, these wounds we either is an entry wound as an exit wound. Again, there is the same pattern. We write length, width, and depth. Again, exact location, and either bone exposed or not exposed. But there are some differences between firearm injury and history of fight, because in firearm injuries you have to give entry wound location and exit wound location, and one point which is different from lacerated and incised wounds. One thing which we add here is margins of the wounds. Either margins are inverted are everted. In case of entry wounds, the margins always inverted, going inward. In case of exit wounds, margins are everted, going outward. What another difference you find on the margins or entry and exit wounds? You can have blackening, around the wound. This point is very important. You can always have blackening on entry wound, not exit wound. Blackening showed when blackening is important in case to measure how far the range or victim present from the assaulter. Another important thing, exit wound always greater in size than entry wound. Always the size of the exit wound is larger than entry wound. These are some points which you have to write or keep in mind when writing firearm injuries or firearm wounds. Again, length, width, depth, exact location, either bone exposed or not exposed. And additionally, you have to write margins of wound, either going inward or outward. What is the condition and shape of the margin? Either blackening present or not present, and check for that exit wound always greater than entry wound. It helps in identifying entry and exit wounds. And next thing which is important, that investigations. In case of firearm wounds, investigation, you have to write some X-rays, some ultrasounds, and in case of if there are chest penetrations or abdomen penetrations, you have to write ultrasounds, and you have to take opinion of radiologist for bone injuries, and from surgeon, general surgeon, for surgical notes, which being helpful for you after final opinion. When you write final opinion for these type of MLCs, surgical notes are very important. And anything, if bullets are present inside the body, then surgeon have to send these back to you through constable police. Next is the dental injury. In dental injury, there are some differences for location of dental injury than a fight and firearm injury. In dental injuries, you look for a condition of gum, either swelling or any bleeding from gums. Next you find any swelling on face, any incised or lacerated wound on face or lips. After seeing these things, condition of gums, either bleeding or any injury, swelling on face, incised or any lacerated wound present on face or lips, you have to locate any tooth which is tilting or any tooth loss, for which you have to write a diagram. You start from 1, 2, 3, 4, 5, 8. Right, left. This is very important. These are 4 tooth which are called central incisors.